Hi, I'm Kiana Rush, and this is week 1 of Pharmacology tutoring for Pharmacology 2. I'm a teaching assistant for Dr. Yalda Shokuhinya, and if you guys ever need help with this class, feel free to reach out and send me an email, or any of the other TAs, or Dr. Yalda herself. We're all here to help you. So, during week 1, we're going to be talking about sedative and hypnotic drugs. A sedative is usually calming and is used to reduce anxiety. Hypnotic will encourage sleep. Both usually work with GABA, which is the main inhibitory neurotransmitter. And if you didn't watch the intro to pharmacology, physiology, and drug strategy video, I highly recommend it so then you understand the mechanism of action of these drugs a little bit more fully. The first drug we're going to talk about is Alprazolam. Alprazolam is a benzodiazepine and is also known as Xanax. That is the brand name. It binds GABA A, so it's an agonist of GABA. It will increase the frequency of chloride channels opening. That's important to know. It's used in acute anxiety and some other situations such as panic disorder or issues where the patient needs to calm down quite quickly. It has the worst side effects for respiratory depression. So that means if the patient's taking it with alcohol, which is not recommended, they could have issues breathing. Side effects are ataxia, weakness, dependence, overdose, sleep disturbances. Diazepam is also a benzodiazepine. Its brand name is Valium. It also is an agonist of GABA A, similarly to alprazolam. It increases the frequency of chloride channels opening as well. This drug is also used in acute anxiety. Remember though, alprazolam is the worst for respiratory depression, but both increase the frequency of chloride channels opening. And both benzodiazepines can be used in acute anxiety. So these usually aren't long-term treatments for anxious patients. Zolpidem. Zolpidem is a hypnotic drug, so it's used for sleep, not anxiety. It also works with the GABA channel, but it binds GABA 1A, so it works a little bit differently. There's usually less tolerance and dependence compared to benzodiazepines, but it also doesn't have the anxiolytic effects that benzodiazepines have. It's usually used as a short-term hypnotic or sleep aid, but a few people I know take this nightly and don't have issues with it. So I don't know if it's commonly used short-term, but I think it is a drug that's prescribed frequently. I remember that Zolpidem starts with a Z and sleep, lots of Z's. So if that helps you remember, I would encourage using it. Buspirone. Buspirone is different. This is a chronic anxiety treatment. It works by being an agonist of serotonin. Serotonin generally helps the patient feel good and have a sense of well-being. It's an anxiolytic, so it stops anxiety. And remember, it's used for this chronic anxiety, as where alprazolam and diazepam are used in acute anxiety. Buspirone is used in chronic anxiety. GAD is generalized anxiety disorder. And it's important to know that buspirone will take 3 to 4 weeks to be effective, and that's because the concentration of serotonin needs to build up a little bit in the brain before the patient can really feel the effects and feel stable on this drug. My mnemonic for buspirone: you take the bus every day, and this gives you chronic anxiety, and you're always waiting for the bus. And that's because buspirone needs 3 to 4 hours to work. Some of the good things about buspirone: there's no additive effects with alcohol, and that's because it's not working with GABA, it's not a downer. So patients can still enjoy their glass of wine with dinner or whatever else when they're taking buspirone. It's not effective in severe anxiety or panic attacks, and that's because it's not a rapid onset. It takes time to work. So in severe anxiety or panic attacks, alprazolam is more frequently prescribed. It doesn't impair memory and coordination, so patients can take it and go to work normally or drive. And there's usually no withdrawal or dependence on buspirone. So remember, buspirone, chronic anxiety. Alprazolam and diazepam are more for acute anxiety. Propranolol. So at this point, you've probably seen propranolol a couple times. It's important to know. It's a beta receptor blocker, so it's an antagonist, and it's used for anxiety and stage fear. Those are its main uses. Barbiturates. So these are working on the same channel as the benzodiazepines, which were alprazolam and diazepam. But it works a little bit differently. Barbiturates are much less commonly prescribed for a certain reason, but they'll increase the duration of the GABA chloride channels being opening. And the opening in alprazolam and diazepam, it's just the frequency. So they're opening, here and there and here and there, as where with barbiturates, they're just staying open. They're increasing the duration, so they're open longer. So remember, barbiturates increase the duration of the GABA chloride channel, and the benzodiazepines will increase the frequency of the GABA chloride channel opening. Barbiturates are used in babies occasionally as an anticonvulsant, and that's actually probably one of their most common uses still today. So as you see, they can be used as an anti-epileptic in infants and short-acting IV anesthesia. So these are a little heavier than the benzodiazepines as well. It's a sedative and hypnotic, and this is why it's less commonly prescribed, along with this first risk. So barbiturates induce CYP450 enzymes. Remember that CYP450 enzymes are your drug metabolism. So if we're inducing your drug metabolism, you're going to decrease the concentration of other medications you're taking. And this could be dangerous in a patient who's on blood pressure medication, per se. If they were given a Barbitol drug and it decreased the concentration of their blood pressure medication, it could cause dangerous hypertension in that patient because it induces CYP450, so they're going to burn through their other medications more quickly. Barbiturates or barbitols have a low therapeutic index. That makes them dangerous. That means that the window you can prescribe them in is very narrow. And as you see, benzodiazepines are over here on this graph, a little bit more safe. Barbiturates, the concentration just increases. So you need to really be careful with the dosing of barbiturates because you could overdose much more easily than with a benzodiazepine. So it's important to know for barbiturates that they induce CYP450. They're used in infants as an anticonvulsant. They increase the duration of GABA chloride channels opening. And you shouldn't use them with alcohol or antihistamines, other drugs that are known as downers commonly. Ethanol. Ethanol, everyone's generally, I think, pretty familiar with. It's a CNS depressant when used in large amounts, and it can be synergistic with other downers such as alprazolam, barbiturates, Valium, zolpidem. You don't really want to mix them with alcohol because they'll have additive effects. It can be used in methanol poisoning and ethylene glycol poisoning as an antidote. It will kind of overcome those other alcohols and hopefully save the patient from blindness and death. Some people with heritages from East Asia or even Native American people will have a polymorphism in alcohol dehydrogenase, and they have a different metabolism for ethanol, and they may feel the effects of ethanol longer because of it. Disulfiram, the last drug for this week. It's used in alcohol withdrawal and to prevent alcohol relapse. So this is a drug that's commonly prescribed to alcoholics who cannot abstain and want to use something to help them stop their drinking. So it actually inhibits the aldehyde dehydrogenase enzyme, and that's the enzyme that's responsible for breaking down ethanol and getting rid of it from your system. It causes acetaldehyde syndrome. Acetaldehyde syndrome is basically your massive hangover. So this person over here is George Best. He's well known for using disulfiram to control his drinking, kind of unsuccessfully. And he actually had these pills sewn into his skin, so he didn't have a choice. He didn't have to take them, they were just there. And when he drank, it would induce that massive hangover feeling and discourage drinking. Some side effects of disulfiram are similar to a hangover: headache, facial flushing, hypotension, nausea, vomit, dizziness, and tachycardia. So remember, disulfiram is used in people who want to abstain from alcohol and are having trouble doing that. So people who want to be sober, disulfiram, such as George Best, the famous soccer player. Ethanol can be used in methanol poisoning and ethylene glycol poisoning as an antidote. Some people have polymorphisms or changes in the enzyme and don't metabolize it as well. Barbiturates increase the duration of GABA chloride channels being open, and they induce CYP450 enzymes, so they'll increase the concentration of other drugs. Remember, they can be used in infants as an anticonvulsant, but you need to be careful because the therapeutic index is very low. So overdose is common, and the dosage needs to be very precise in barbiturates. Propranolol is a beta blocker, and it reduces anxiety and stage fear. Buspirone is used in chronic anxiety, and it works with serotonin. And because it works with serotonin, it needs 3 to 4 weeks to work. Zolpidem is a hypnotic, and it's not an anxiolytic. It's used for sleep. Remember, zolpidem, Z's. Alprazolam and diazepam are both benzodiazepines, and they'll increase the frequency of the GABA chloride channel being open. Both are used in acute anxiety, but alprazolam is the worst for respiratory depression when used with other downers. If you have any questions about sedative or hypnotic drugs, feel free to send me an email, and I'll make sure these notes are available to you week 1. And as always, good luck and happy studying with Pharmacology 2.